Well, we're here with Dr. Piskin today, a dentist in New York, in fact in Floral Park. That's that's almost Long Island already, isn't it?
It is on Long Island, yes. It's in Nassau County, Long Island.
It is on Long Island already. Well, Dr. Piskin, there are many dentists out there, and to ask people, to a certain degree, a dentist is a dentist is a dentist is a dentist, and that may be true. But can you shed some light on it? Of what is your philosophy in your office? Is there something which you think differentiates you? And maybe even why did you become a dentist? Well, what does it make for a person to become a dentist? What's behind it?
Well, I think a person needs to love being with people. That's important because you are with people, and not just one or two every day, 20, 30 people every day, and you get to know them well, and you get to know about their families and their lives, and you kind of get intertwined in their family life. And as you grow in a dental field, you hopefully can keep these patients loyal to that they'll return to you and love coming back, and it's a family. And also, I think it's important that you need to enjoy and be good at working with your hands, have good manual dexterity, eye-hand coordination, and, of course, the idea of you are giving your time endlessly to helping the people in the community for their dental needs and dental disease, and volunteering your time for a lot of other things, which we do here in the office as well.
Great. Now, in terms of performing dentistry, there are different philosophies out there in terms of what work a dentist does. I mean, even though dentistry is already a specialty of the whole medical field, but in dentistry there are orthodontics, there are all kinds of things. Tell us a little bit of all the work you do in your office, and what's your philosophy there? Are you kind of one roof does all, or are you like a person who sends out a lots of work to specialists? What's the deal there?
I do most of my work here, but I do have a very wonderful niche of specialists, if I need them, that can help me with cases that are more difficult, that they need special care with. I am a family practice. I do a lot of also cosmetic work. Of course, everybody says they do cosmetic work, but it takes a special person to have that kind of eye to know exactly when you look at a smile what's working and what's not. And also at the same time being able to work with a 5-year-old child and help that child not have any fear when they come to the dentist, and have your staff well trained. So it's a type of practice where the families come and they can get all kinds of services, whether it be orthodontics, whether it be cosmetics, or just basic care, nutritional counseling, orthodontics, like I said before, and working with implants, which is a great service today, where we can replace teeth where people had missing teeth, and removable appliances that they're not very comfortable with. So my practice is a general practice that has a specialty in cosmetics, but also loves children, and we do have a lot of children. And I had worked at many day camps over the years when I was much younger. I have an affinity to really be attracted towards children as well. And we really love them a lot. And I'm at the point where I'm starting to see some of those children now getting married and having their own families. And it's a great joy to see that, and working with their children as well. So second or third generations, even though I'm only 20 years old, obviously you can see that.
Definitely, I wanted to say, I mean, that's, you're holding time still, I mean, or you're lying to us. How can you possibly see those, kids by now? Well, anyway, Dr. Piskin, so, yeah, with no doubt, something you mentioned in terms of like being able to see things, so many professions, and I think dentistry is definitely one of them, where, yes, you need to have technical knowledge, but you gotta be also an artist at the same time. Otherwise it's just only straightforward technical, millimeter by millimeter. Yeah, technically it's right, but somewhere along the line it just doesn't feel quite right. And in dentistry, that's a big picture I have seen, a big fact. Would you agree?
I would agree. You do have to have an artistic eye when you look at someone. It's not the same to just fix a tooth and give it a white tooth, But the question is, does it fit in with the rest of the teeth? You know, if you have actors on stage, are all the actors in unison when you pull that curtain up, or does something look out of whack? And you have to have an eye, and we are working in very tiny millimeters, and whether the tooth is tilted to the left or straight or too long or too fat or doesn't match, it's important that you have the right eye and training to put that all together so that when someone leaves the office with, whether it be one teeth or multiple teeth, having some sort of dentistry, no one out there is going to really know, or they're going to look at it and say, that's really pretty.
Right.
So you do have to have something with an eye on that helmet.
Right. And I'm sure you kind of, you said something, you pay lots of attention because, you work with children, you work with everybody. So it's not that everybody wants a Julia Robertson or a Tom Cruise smile. It's, or maybe want it, but it costs money. But I think, one of the most important things is to get people the acceptable, good, functional, and yet still good looking type of, dentistry, like clothing, we don't all need to wear Gucci suits for $3,000 or $6,000. A good couple $100 suit, if it's overall fitting the body, that's just a job for most of us.
I agree. You have to listen to the patient. There are patients that want one thing, and there are patients that want the opposite. And if you're closed-minded and not a good listener, then you will not make these patients happy. They will not have their needs met. Some patients don't care about the way their teeth look. They can be dark, but they want to chew well, and they want to have healthy mouths, and they don't want to walk around with disease. They don't want to have disease that starts in the mouth and maybe goes to other parts of the body. So you want to listen to their patients. You want to educate them so they know that they have choices, what's happening in their mouth. Most patients do not really have a clear picture about what's happening, and that's sad. And I do like to spend the time, and we have consultations. We don't charge for consultations so that we can educate them, and they can make intelligent decisions. And I can sleep at night knowing that I've informed them about everything. And even if we do a little bit at a time, a lot at a time, at least I know they're going in the right direction. And that's comforting to me.
Right. Well, now we know the secret why you're looking so good, because you can sleep at night. Dr. Piskin, thank you very much.
Sleep is very important.
Thank you very much. Bye-bye.
You're welcome.